Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop elbow pain. But before I do that, I'm gonna go over two of the most common causes for elbow pain and other issues that could increase your risk factors for having elbow pain, and then we'll go over the normal healing cycle and how to get to the root cause of the elbow pain and treat it at home safely. So one of the most common causes for elbow pain is tennis elbow or lateral epicondylitis. And usually you can see it here on this image. It's the outer side of your elbow. This is the area that usually the location for lateral epicondylitis or tennis elbow pain right here, and this is the location for tennis elbow, and usually it's at the outside of your elbow, usually inflammation, scarring, and the tendon here. That's usually happened due to the damage to the extensor carpi radialis brevis, and it's attached here to the elbow bone. And that cause weaknesses in your wrist or your elbow, and the pain usually in the outside of your elbow, and pain actually sometimes radiated down to your forearm. The causes for elbow pain or tennis elbow is if you do a lot of backstroke, painting, driving a screwdriver or screws, repetitive computer mouse movement or use, also cutting food or plumbing. So any motion that actually causes a lot of repetition with the backstroke or a lot of typing or a lot of mouse movement that you overuse this muscle, that could be a risk factor for having tennis elbow. So the risk factors, if you are over 40 years old, repetitive motion, obese, or a smoker. The second most common elbow pain is called golfer's elbow, and that's actually on the opposite side of the tennis elbow. So the tennis elbow is usually the outside of your elbow here. The golfer elbow is inside here, and it's the same thing. Happened due to repetitive motion and damage to the flexing and the pronated muscle of your elbow. And you can see it here. You might have micro tear, scarring, and inflammation in this area. So the causes also tennis or sports, and weight training, occupation like carpentry, plumbing, or construction work that actually doing a lot of repetitive motion that cause micro tear to the medial part of your elbow. So symptoms: you will have pain in the inner part of your elbow. You will have weaknesses in your wrist and your elbow when you do any movement, pain difficulty with opening a knot or holding a cup and shaking hand and stuff like that, and pain would happen with resisting the flexion, wrist flexion, and pronation. That's usually a sign of golfer's elbow. So the other thing you might experience, and that's not very common, if you have fracture or you have like arthritis or bursitis in the elbow, that could cause elbow pain too. But I'm just focusing on the two major ones in this video. So how to get to the root cause of elbow pain? Well, in order to answer this question, we have to really understand the normal healing cycle, because it doesn't matter if it's tennis elbow or golfer elbow or fracture or bursitis, tendonitis. All of them has to go through one program, one normal healing cycle if it's healed. So our body has to go through 3 stages in order to heal. I'm gonna use external paper cut here for visualization, but the same process happened internally from tennis elbow, golfer's elbow, fracture, bursitis, tendonitis, but we don't see it because the skin cover it. So first stage of healing, as you see here, is called the inflammation stage. That's when you have swelling, redness, the blood starts to rush to that area and experience pain. Second stage of healing is the proliferation stage. That's when your body starts to build the scar tissue, and you start to have fascial restriction, muscle spasm, and trigger points. During the proliferation stage, our body has to heal itself or close the wound. So if we don't have a scar tissue here, your tear will be like open wound susceptible for infection. So scar tissue actually very essential for our survival. Why scar tissue could be an issue? Because our muscle should act like a rubber band when it contracts and relaxes, stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band. When your muscle contracts, it will not stretch much. And that's very common with tennis elbow and golfer elbow. You start to have a lot of scarring here that will limit the range of motion of your muscles, so the muscle will not be very stretchy. So when you stretch with extension, wrist extension, flexion, you don't have that enough room to move, and that could cause pain. Perfect scenario during the maturation stage, your body should get rid of everything in the proliferation stage and the inflammation stage. That could take days, weeks, months, or years. If you are in a chronic condition, your body probably going back and forth between inflammation and proliferation stage. And in order to really get to the root cause of the elbow pain, we have to break that vicious cycle. So I want to show you in this image what's look like when you have a scar tissue. So this is a normal tissue on the left side here, and the muscles, everything nice and smooth. When you start to have a micro tear in the muscle or a tendon or a ligament, it's gonna look like randomly here. And you can see it in the other image here for golfer's elbow or for tennis elbow. You start to have a kind of micro tear here. So your body has to build the scar tissue to heal itself. If it doesn't, so it will be permanent tear. We want the scar tissue. The problem is when you start to have excessive scar tissue like this image here, it's gonna randomly build up. And I want you to try now, just touch your elbow. Feel, if you start to feel there is like a knot, there is like a scar, there's a chance that's a scar tissue, or fullness, thickness of the tissue and painful knots in either side, that's a sign you have a scar tissue. And that's one of the things we really need to get rid of, because in order to get to the root cause of the problem, we need to really get rid of the inflammation and break the proliferation stage. So how to do that? Before I answer this question, I'm gonna go over several non-effective treatment that commonly used, so you don't have to waste your time on it. One of the commonly used by a lot of healthcare providers is stem, heat, and ice. When we look at the normal healing cycle, they're not gonna break the scar tissue, they're not gonna release the fascial restrictions, and temporarily the ice will decrease inflammation, but nothing else gonna it will not address the root cause of the healing cycle. And based on a study, it provides temporary pain relief, and there is no long-term relief reductions. The other thing that commonly used, massage and foam roller. And think about this way: if you have inflammation and you keep rubbing it, you're gonna inflame it more. And when I go over the fascia system, it will make a lot of sense why the foam roller and the massage are not effective, because actually mechanically impossible with the foam roller that's very superficially working on a soft tissue, or the knuckle or the hand or the elbow for the massage, to go deep enough to really break deep adhesion. We need to have mechanical force actually to go deep enough to really do the deep release. And based on the studies, several systematic reviews showed that massage and foam roller either provide short-term pain reduction or no pain reduction. So there is no long-term pain reduction. The other thing that commonly used by a lot of healthcare providers like PT, chiropractor, OT, joint mobilization. But think about this way: you have inflammation and you have a scar tissue, fascial restriction, all of that in the muscle, the tendon, the ligament, and you can see it here. Moving the joint is not going to do anything to inflammation or proliferation, but too much moving the joint or mobilization, that could cause internal inflammation. And based on the studies, joint mobilization either provide short-term pain reduction or no elbow pain reduction. The other thing that commonly used, and I personally do not recommend to any of my patients, stretching. Think about this way. You have a tear here, you have a micro tear here. So if you stretch, you're gonna tear it more. And based on the studies, actually stretching could cause more inflammation. So actually, if you do stretching, you're gonna make your symptoms worse. So that's why I don't recommend it, period, for any musculoskeletal injury. There's other safe option than stretching that we can do without causing harm. So please don't stretch. The other thing that's commonly used is a strengthening exercise, but the problem is when you start to do that during the inflammation stage, you start to strengthen, that will cause more inflammation. But there's other better option than strength exercising, which called function training, and I usually introduce that after breaking this vicious cycle of inflammation and proliferation. Strengthening exercise is not going to decrease the inflammation. It's actually increase it. And it's actually will not break the proliferation stage. It will break the scar tissue, release the fascial restrictions. We have to really break that vicious cycle and then do the strengthening or function training exercises, not the other way around. So how to get to the root cause of the problem? Well, first of all, if you have a mild inflammation, just wait, don't do any activity, rest for 5 to 7 days. That should be good enough to calm the inflammation down. Minor cases, that should be recovered by itself. But if you have moderate to severe inflammation, your body is going back and forth between inflammation and proliferation, we have to be aggressive to decrease that inflammation. So to do that, I personally use a MagnaHeal 2. This magnetic device is actually, the magnetic range is around 3 inches. So it actually penetrates the body 3 inches. And I personally had tennis elbow after moving boxes in my office. And I had a lot of inflammation. So what I did, I personally just put the MagnaHeal on it for a few hours, and that helped to decrease the inflammation. I addressed it in the acute stage, so I was able to get it under control quickly. So for moderate to severe inflammation, we have to be a little bit aggressive on decreasing the inflammation. So what I personally do is I put my patient on anti-inflammatory diet to make sure they're not eating food that increase internal inflammation and slow down the healing cycle. For severe inflammation, we have to be aggressive on addressing the inflammation through supplements while we decreasing the localized inflammation. So what I personally do, I use a pain relief cream. That cream has several vitamins and minerals to help decrease the inflammation while I'm using the MagnaHeal. At the same time, I put my patient on the anti-inflammatory supplements because those condition that has severe inflammation, they usually have vitamin, mineral deficiency, and other deficiency that their body is not really have internally to decrease the inflammation. So the supplement kit is including collagen, omega, magnesium, several other vitamins and minerals to actually decrease those inflammation and breaking that vicious cycle so we can focus on the proliferation stage and get it to the maturation stage. So at the same time, while we're working on the inflammation, we have to break the vicious cycle of the proliferation stage. So in order to do that, what I personally do is I use the A3 to break superficial scar tissue and work on the elbow, breaking any adhesion externally. And at the same time, I have to use E5 to break the scar tissue, fascial restriction, trigger point, and that's why I said massage or foam roller are not effective, because with the massage or foam roller, we're not going to be able to go deep enough to cause mechanical force. I personally use the A5 to actually go deep to release the deep scar tissue. While we're doing that, we have to work on the fascia system. I'm going to briefly go over the fascia system in this video because it's overlooked by a lot of healthcare providers and has significant effect on elbow pain. So the fascia system You can see the fascia, superficial fascia layer. It's wrapping the entire body. You can see it here in this image. The white web tissue here, those are the fascia. And when you go buy meat next time, look at the white filament, and that white filament is actually the fascia. To make things more complicated, there's several layers of fascia, but don't worry, the treatment is very simple. So we have two major categories of fascia: superficial layer and deep layer. And the deep layer is actually divided to four subcategories. And you can see it here in the image. So the deep layer is divided to apparatic fascia that's wrapping a group of muscle. Then you have the epimysin wrapping each individual muscle fiber. You can see it here. And then the premiycin that wrapping a group of bundle of fibers here. And then at the end you have the endomycin wrapping each individual muscle fiber. And to make it more complicated, each of these layers have 2 to 3 layers on top of each other. That's why I said massage or foam roller are not effective, because you cannot isolate those layers with the hand or foam roller. You cannot go deep enough to address the epimycin, premiycin, and endomycin on some layers of the apparatic fascia. So how to address the fascia system? What I personally do is I use the A1 to release superficial and apparatic fascia layers, and then I use A5 to release the epimycin, premiycin, and endomycin to go deep enough to release those layers. And remember, for the proliferation stage, if we cannot apply mechanical force on a restricted area, it will not be released. So if you work only on the inflammation and you ignore the proliferation stage, you still gonna have proliferation, and those proliferation or scar tissue gonna cause more inflammation, and you have not break that vicious cycle. So you need to really break that vicious cycle from both ends. So how to get rid of elbow pain or treat the root cause of elbow pain? First, rest. Avoid the repetitive motion that occupation that require a lot of elbow bending or sports for a week. And if everything calm down, you are good. It's a minor case. If you still have issue, we have to work aggressively on breaking the vicious cycle of inflammation and proliferation simultaneously. And that concludes our video on how to stop elbow pain. If you have any question or comment, leave it in the comment section below and I will answer it in the future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.